I had been working 9 out of 11 days, and I got home from a shift, got into bed and just felt full all over body aches from my neck to my toes. It was quite intense with the body aches and the fatigue and headaches. And then it kind of came and went in waves.
Nurse Sasha King is one of around 80% of Victorian healthcare workers who contracted COVID-19 at work.
I was almost feeling like it was a joke. I just probably didn't want it to be real. We're people just like everybody else trying to get through this incredibly hard time. When I hear stories of people's friendship groups distancing themselves from them, when I hear about people's family members treating them differently, look, without our support network, our job is so much harder.
The Royal Melbourne Hospital nurse says that health workers are disproportionately affected by the virus.
I think that we're not probably willing to talk about it either. I think we're a stoic bunch and we just want to get on, and we're so busy we don't have time to think about those kind of things. Mental
health is the unseen side effect for those wearing PPE on the front line.
I can't speak for everyone else, but for me, of course there's anxiety. You don't know what you're going to come up against during that shift.
Also at Royal Melbourne, Dr. Killian Ashey has just come off shift on the psych ward.
Finishing up a shift in what's been a particularly busy day for psychiatry here at Royal Melbourne, with unprecedented demand at our emergency department, but also unprecedented, unparalleled levels of acuity, of urgency, of illness and distress here at the psychiatric unit. Even just removing the PPE, it just reminds me how difficult it is to optimise communication with our patients at this time.
He says he's seeing the effects of employment-related stress in his patients at its extreme end.
So another young person today who has lost their housing because of job loss, has no income, wasn't able to afford their medication anymore, and has had a psychotic relapse of schizophrenia.
For some 80% of Australian workers, help can be a phone call away.
I think EAPs, or employee assistance providers, are by far the least known and most valuable mental health service Australia has. These are free services provided through employers to people.
Data compiled exclusively for 7:30 by Converge International shows a surprising snapshot inside the minds of their some 2 million client employees around Australia. Counselling over careers has increased by 15%, a 25% increase in advice for management dealing with layoffs and redundancies. There's been a 44% increase in financial counselling, and most alarmingly, Converge International has seen a trebling of family and domestic violence related requests for counselling. Grant Brecht represents the peak body for EAPs.
Now, what happens in an organisational context is that you have a captured population of employees, so it is easier to help educate those employees about what good mental health is all about, and I guess to normalise the use of psychological services in the workplace by saying, we work hard around here, but we look after ourselves as well.
I actually didn't know what an EAP was. I had to actually look it up so that I could find out more about it, because I had no clue at all.
Teacher Alison Quick had never contacted a mental health professional before COVID-19.
I suppose I would have gone to the doctor, but I don't know. My local GP, which is great, they can help, but I think it would have taken me a lot longer to get help. This was the way I did it, much quicker than I normally would have. I think if I hadn't had access to the EAP, I would have really struggled a lot more, and it frightens me, but I'm sure I would have fallen into a much deeper depression. It really felt I could feel things falling in around me, and it was only going to get worse, I'm sure of that.
Sasha King has now recovered from COVID-19 and is back at work, hopeful that the stigma around both the virus and the mental health fallout it's created can be combated by speaking up.
It's important that people realise that they're not alone. And if you're feeling vulnerable and unsure yourself, reach out and tell someone, you know, because we are all here going through it together. It's important.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.